Hi, I'm Mark from Livewell CPAP Medical Supply. I'm going to go over the React Health Luna G3 today. It's a relatively new machine, been out for a couple years. What I'm going to do is I'm going to go over some general settings and general maintenance on it. First thing we'll do is we'll go over the screen settings here. So I push the button to wake the screen up. Now I've got the screensaver on, so if I push the button again, it's going to give us the menus here. And you can see if I scroll through, there's a few different things here. So this is the preheat. If I click on it, you'll see it will go into a 30-minute countdown. What that's doing is it's preheating the heating plate, so it starts the evaporation. So the first little bit of therapy is going to be a lot more warm and humid. I typically will do that if I'm ever congested. Now you can see if you let it sit for a minute, the screensaver will pop back on. I'm going to click on this to open it back up. You've got an accessories piece here. So if you click on it, you've got air filter, tubing, and mask, and you can actually set these to give you reminders of how often to change these items. And I'll show you where that is in the settings in just a minute here. I'm gonna press the home button, gets us back out. If you click over into the mask, there's two pieces into the mask. There's a mask type. If you click on it, you can choose a full face or a nasal pillows. I typically use a full face, and so I'm going to leave that there. The other option on here is the mask fitting test. Now, if you click this, and I'm going to hold my finger over the end here, it's going to tell you if your seal is good or not. So the nice thing about the mask fit function, I'm going to turn it off here, is that if you're on a ramp with the machine, it's going to give you a blast on your full pressure. If you have auto set where you're on a very low minimum and a high maximum, it'll give you a blast of pressure so you don't have to worry about having masks leak later on into the night. Wake it back up here. Going to get back to the home report. If you click into this, this is going to tell you how you're doing. So your usage summary tells you bits and pieces here. You can go 7 days, 30 days, 90 days, and so on and so forth. I'm going to press this. It's going to get us back out here, but it does give you your used days, how many days for more than 4 hours. That's for Medicare compliance, average use time. And then there's it'll give you your average pressure. So if you're on an auto set machine, I'm between a 13 and a 14. It'll tell me what the 95th percentile pressure is there. Your average, your AHI there, and then your central apnea index and your average leak there. So it gives you a quick snapshot of what that looks like. If I hit back home, it's going to get us back in here. There's also a QR or a iCode Connect QR Plus, and then an iCode. And these give you little reports to your phone if you'd like, or to your doctor. And we'll go over those in a bit when we get into main menu. If I press the home screen, we're getting back out there. If I go into the settings option, the opposite way here, and click into settings, I've got the humidity setting. Humidity is anywhere from a 0 to a 5. So off 1, 2, 3, 4, and 5. Auto means it's going to sense the room temperature and keep guarantee that you're not going to get condensation in the tubing. I like to pick a number because it gives a little bit more humidity. So for me, I sleep on about a 3. What I've noticed is if I do go up to a 4, I start to get water in my mask. I do sleep in about a 68-degree room, and so that can affect at what point you get water in your mask. The other thing about that is your humidifier chamber, I found, will still have a little bit of water left, at least for me. If I sleep for 8 hours, if I'm set to 3, a little bit more than that, it tends to run dry. Next piece is your heated tubing. So if you do have heated tubing and it's connected, you can activate the heated tubing there. You can set the tube temperature. I'm going to hook this up so you can see that. Got our heated tube here. And on the top of the heated tube, there's a little piece that you can see that says, 24 volts, and it's going to plug right into the back here. And that should be on top, the 24 volt piece. Now, if I go back into my menus, I now have a tube setting. And the warmer the tube setting, the less likely you are to get condensation in the mask. Now, one thing I've noticed, just as a side note, if you do use unheated 15 millimeter tube, the machine is a little bit more quiet. It's pretty quiet either way, but it does tend to be a little bit more quiet. And the folks that I know that have used this machine have reported that back as well. I go back here to ramp time and click on it. I can change that, and that's going to start at a lower pressure and gradually work up. I've been using CPAP for, I don't know, about 13, 14 years, and so I don't typically like that ramp, but for folks that are starting out, it's really nice to have that. Next piece down, I'm gonna lock it in here on off. Next piece down, you can see there's a certain amount of tubing on there. Now I am gonna unplug the heated tube from the back so it doesn't know which tube I'm using. Let's go back here. If I click onto that, you can do either the 15 millimeter tube or the 20 millimeter tube. On this particular machine, my personal preference is using the 15 millimeter tube. It makes it a little bit more quiet. And you can change that right there. If you do have your heated tube connected in there, it automatically defaults to 22. Your accessories reminder, that's, as I showed you previously on your accessories, you can click into there and you can change this to remind you how often to change your air filters, how often to change your tube. You can change, do a reminder of 30-day time gaps there, and then your mask and how often to change your cushions. The next piece on here is something that has kind of been important to me. So it's the delay on or off. And what the delay is when you hit stop in the morning, it's going to blow a little bit of air again for another 30 minutes, similar to the warm up. But what it does is it blows that air so you don't have any excess condensation in your humidifier chamber. The reason why I've chosen to turn this off is it does tend to be pretty bright. So I will usually wake up before my bed partner does, and when I hit stop in the morning, if it does do that delay, if it's activated, it's bright for about 30 minutes unless you actively shut it off. You have to push the power button to shut it down. So I usually leave that off. But if you do want a little air to blow through the circuit to get rid of any excess condensation, I would activate that. And again, click it, change it, and activate it there. Brightness, I have it set to high right now, and that's just so I can see the screen from an angle as I'm going through this with everybody. But typically when I'm using this machine, I'll have it turned down to low, just so it's not nearly as bright. Because it does, when you hit start on the pressure, it'll take about 30 seconds to go into kind of standby mode where the screen darkens out. But I'm going to turn that back to high just so I can see as I'm going through this. Next part on there is there's just a time or a screensaver on here that shows the time. And the standby is just when it's sitting there. It does shut off after about 30 seconds, but when you hit stop, it pulls the time and the date up. And it also shows you where your humidity settings and tube temperature settings are. I've left it off for now because it kept, as you noticed in the earlier part of the video, it kept going back to the screensaver. And then the work screensaver is when you do hit start, it sits nightly and it's on, so you could look over and see the time if you wanted to see that. But it does have a little bit of brightness there, so people that are sensitive to light may not want to have that activated. Next piece on here, the auto backlight. There's two options. You can leave your backlight on, and that's on all the time, or auto, where it goes to sleep after about 30 seconds. I like the auto function just because, again, I like to sleep in a dark room. My bed partner likes to sleep in a dark room. Wi-Fi it's connected, and it's going to be a cellular modem that's connected there. Next piece in here is the time. You can change the time. We're active where we are. That's the correct time. And then we have the date there and the date format. And you can choose to do a time format as either 12 or 24 hours, and then your language. That's pretty much it for the menu here. I'm going to press the home button, get us back out there. Again, kind of some highlights on here. You've got your auto CPAP set, your your minimum and maximum pressure, it's just a fixed pressure, and then your res lax. And the res lax is when you exhale where the pressure dips. And that would need to be activated by your home care professional, and then you can adjust that. For all of your washable pieces, your tube and humidifier chamber, you can do two ways. You can do water and a mild detergent, and that's what the manufacturer recommends. Or you can do a water and vinegar solution. So 3 parts water, 1 part vinegar. That's typically what I'll recommend for patients who have who are a little bit more worried about really disinfecting their supplies. The manufacturer will tell you to do the humidifier chamber and the tube daily. I typically will do it about once a week. Sometimes daily can seem like it's going to take a long time to get going in the morning. So the tubes, if you're just using soap and water, what I really like to do and what I found is these, the 22 millimeter tubes, the ends on there, I'll put a squeeze of dish soap down there, wiggle this onto a faucet. Most household sink faucets are about that same diameter, so they'll stay there by itself. Turn the faucet on, let the water pressure push the soap through, and then let it air dry. I'll usually hang it on a towel rack to dry. And you can do that for both the heated tube and the non-heated tube. Although if you do want to soak it in a water vinegar solution, you can get this wet. It's not, just make sure it air dries before you plug it in. Your filter, I would recommend, the manufacturer doesn't necessarily, I looked through the manufacturer's manuals and didn't see a whole lot, or didn't see a recommendation of time, just a recommendation to change it out every 6 months. But I would wash that about once a week. That's where I've noticed, and it really kind of depends on how dusty the area you live in is. For me, I live in a fairly dusty area, so you need to rinse that out. I need to rinse it out about once a week. And then it's just gonna go back into the cover. Snaps there and just snaps then. And then again, to release it, you just press down on the top. To wash the humidifier chamber, push it down to release it and then pull it right off. And then I usually, when I wash it, I soak it in a basin full of water or water and vinegar, soap and water or water and vinegar. Just make sure this is a little bit of a separate compartment in the case, in the top part of the humidifier chamber there. And I make sure both parts are under the water in that soapy water. This piece, if you grab and pull, is gonna pop out. Manufacturer recommends washing that about once a week as well. Warm soapy water also, and then drying it with a soft cloth. And it just presses in there. You do, to kind of get it out, you do need a little bit of dexterity in your fingers. Pinch and give it a good tug to get it out of there. It's the silicone on plastic, and then it just push it all the way back in there.